afternoon, everyone, and welcome to, I believe, the first for this year for the CoBReG webinar series. Today, we have a very august person to touch on a very relevant subject. But before we go into all of that, let me first of all apologize for the slightly late start. Technology always would fail you at some point, so we apologize for the slightly late start. So my name is Kweju Asamoah-Kusi. I'm a Associate Professor of Immunology with the Noguchi Memorial Institute for Medical Research, and I'll be hosting this meeting this afternoon. I would ask that if we have any questions, there is a Q&A tab that we posted in there while the webinar is ongoing, or even during the Q&A session itself, and those will be read out, and we would then get answers from the presenter. If you want to be identified as such, let us know. You can just add your name at the end. Some want to be anonymous, that is also fine, but all the questions should go into the Q&A chat. Luckily for us, I think we are all muted, so I don't have to make a comment about us muting ourselves. So please, let's get started. So today we have a very special topic on cancers. Doc, can you already project the slides? Yeah. So we have in our midst today Dr. Mercy and Nuamah. Dr. Nuamah is a distinguished clinician scientist and the founding head of the research department and a senior research fellow at Family Health University, which is based at Teshi in Accra. A graduate of the Moscow Medical and Dental Institute with a PhD from Kyoto University Graduate School of Medicine in Japan. She possesses a rich background in clinical medicine and academic research, having previously served as a research coordinator at the University of Ghana Medical School and a lecturer at Doshisha University with over 40 peer-reviewed publications. Her work is deeply rooted in maternal and fetal health, with a specialized current focus on screening, management, and elimination of cervical cancer. In addition to her research leadership, Dr. Nuamah is a dedicated medical officer who serves as a visiting doctor at Enchi Government Hospital, an editor of the Journal of Family Health Medical School, and a member of the International Papillomavirus Society, consistently bridging the gap between advanced science, inquiry, and community-based healthcare delivery. So this is our guest for today, Dr. Mercy Anna Nuamah, and she will be speaking to us on when cancer strikes, understanding disease progression and survival. Doc, thank you very much for accepting the invite from CoBReG, and we welcome you to deliver your presentation.
Thank you very much. Good afternoon, honorable participants of today's webinar. Thank you for taking time out of your busy schedule to join us. First of all, I would like to thank the management of Convention for Biomedical Research Ghana for giving me this opportunity to share what I have learned on cancers and to lead this discussion that will help some of us to overcome the fear of cancer and to live a successful life when cancer strikes. I would also like to thank the management of the Family Health University for giving me this opportunity to continue learning and to share my experience in teaching and in research and in clinical practice. We say when cancer strikes. Somebody say, why not if cancer strikes? You remember last week, 4th February, was the Global Cancer Day under the theme United by Unique. And I would like to quote a statement by the Honorable Member of Parliament for Abrikuma North, Ghana, Honorable Irabina Abin. She said, this day, meaning the World Cancer Day, powerfully reminds us that behind every statistics lies a unique human story, a cherished individual, a grieving family, and a tight-knitted community forever altered by the scourge of cancer. When cancer strikes, meaning, yes, cancer strikes everybody, including those it strikes directly, a family, a close relative, and any other person. Why does it matter? Cancer is a major global health challenge, being one of the leading causes of death, disability. Presently, it is a public health crisis, transcending gender. It does not care about your pocket, how much money you have, or where you are from, or where you are going. The International Agency on Cancer Research estimated or published in 2022 that there were 20 million new cases annually and 9.7 million cancer-related deaths. WHO also estimates that if nothing is done about this, 1 in 5 people will develop cancer. 1 in 9 men will die from cancer, and 1 in 12 women will die from cancer. This is grievous. And why? There are so many diseases in the world. Why do we worry about cancer? People can die from pandemic, from heart disease, heart attack, from anything. But when people hear the word cancer, there's some chills that goes into them, because cancer comes with a lot of pain, financial, crippling, and so many things. When we come down to our local Ghana, our health authorities and the cancer registry said there are over 24,000 new cases of cancer in Ghana every year. This is 20 million. It's also the whole Ghana population is about 32 million. And if 20 million people in the world die from just one disease, look at how grievous it is. So let's look closely at the statistics in Ghana. What kind of cancers do we usually face? The top is breast cancer, liver, cervix, prostate, and other cancers. However, this is the new cases recorded in 5 years prevalence from the Kumasi registry, said that over close to 64,000 in 5 years. But this is just 1 year statistics, 27,000. Then let's look at the related death from the cancer. There were, out of the 65,000, close to 18,000 related death. And most of them, if you take for women and men together, over 18,000, there were over 9,000 females lost their life through cancer. And then over 8,000 men. This is very many people, a lot of people. So what then? The sad thing is that why so many people, if you look at this, over 66% of those afflicted by cancer seem to die in Ghana. Why is this so? Because a lot of them present very late. And why do they present very late? Because a lot of them do not know about cancer, how it can be detected early, how early detection saves lives. And some of them also think when they hear the cancer and the treatment, it sends chills into them and they wouldn't even want to know. And denial, because some say, in Jesus' name, I will not be sick. Yet, surely we may not, but sometimes our religious affiliation also let us, we don't want to face the realities. So people start going to prayer camps, they see some lamps, then they will start using so many herbal medication with that basis. So by the time they present, it's too late. And talk about finances, that also comes into play. What then is cancer? You look at the two cells, and you see one on the left is the normal cancer cells, which is nicely arranged. There's a lot of things going on in the cells, but they are all in their lanes. They all work together. But you look at the right side. So in the normal circumstances, there's a balance between how the cells work. But when this balance is distorted, then there is chaos. As shown, cancer is disruption of the orderliness in the cells. The Webster Dictionary defines cancer as a tumor that tends to spread locally and to other parts of the body, often causing death if not treated, as well as an abnormal state marked by such tumors. It is characterized by uncontrolled cell division and growth. That is the dictionary definition of cancer. Cancer is actually a Latin word meaning crab because of its ability to grab onto the tissue it affects. So it's very difficult even to separate the cells from the things it grabs. And usually, instead of the normal, obeying the normal aging and then dying rules, the cancer cells keep multiplying. What is the root cause of this? Why does cancer arise and then start behaving abnormally in all the other cells? Scientists, researchers have come to know that it is as a result of some mutations, which means disruption in the genetic information, which is caused by environmental or genetic factors. When we talk about genetic factors, what we mean is that it's in the genes. Probably some great ancestor was hit by cancer, and then the gene is lying dormant somewhere. So it's there already. It's waiting for the right timing, right condition, and then it starts showing up. The environmental factors we grapple with here could be radiation, as we know, ultraviolet radiation as a result of the ozone layer depletion predisposes us to cancer. It could be as a result of tobacco use have been linked to so many cancers in the body. Sometimes the food we eat, some fertilizers, we don't know the effect they have on us. All this and so many things, our sedentary lifestyle. So these are all acquired mutation that things that can result in acquired mutation. It has also been established that some viruses, infectious agents like hepatitis B infection or C, and then the popular human papilloma virus. These are known as infectious agents that disrupts the normal functions of the cells and then start causing the cancer cells to grow. So let's start from the beginning and see what happens. The progress. First, we say it's initiated by genetic damage, mutation, which is the disruption in the normal genetic information to regulate the activities of the cells. Then, because it's been disrupted, it starts abnormal cell growth, promoting the cell growing and then increasing in size. Then later it takes over the tissues and then move on to other places. So this has been put into stages. There's stage 0, when it's not pre-invasive, it hasn't spread to any place, and up to probably stage 2, 1 and 2. It's all localized in the tissue it has affected. Then it starts from stage 3, going through the lens and then also taking it away from the tissues until it gets into the blood vessels. Then it's taken to different places. We know that our blood is the logistics of the body, taking essential goods to where it's needed. It carries oxygen, it carries food, it carries medicine and many things. So when these abnormal cells also jump onto this vehicle, then they have free ride to go to any place they would like to go. So the cancer cells, once it touches the blood vessels and get admission, then it's taken to any sizes. Where are these cells taken to? Cancer may spread to distant organs least expected. The patient might come to the hospital and says, I have severe headache. I've taken all the painkillers in the world, but it's not going. Then the doctor examines and so there's some lump into your breast. Have you really realized it? So it's there, it's been there 2 years, 3 years, but it hasn't done anything to me. I don't feel any pain. Then the doctor will ask, go and do this test and this and say, yes, you have cancer, breast cancer, and it has affected your brain. Ordinary people will not understand this. If I have breast cancer, why has it affected my brain? Yes, today we learn, and it's been established that when you have breast cancer, it can spread into your bones, your lungs, your liver, your brain. Lung cancer can spread to the brain, the bones, even to your adrenal glands, which are found on top of your kidneys. Prostate cancer spread to the bones, the liver, the lungs, and then colon cancer, which is cancer of your large intestines, can also go into the liver and the lungs. So it does not matter. There are so many cancers. Skin cancer can spread to also other parts of your body. You'll be surprised that you have a sore in your eye, which you think was just something to go and it's not healing. And it is cancer and can spread into your liver. So cancer takes these highways and then goes to any part of the body where it finds the vehicle sending it. What is interesting is, like I said, there are stages of the cancer progression. And sometimes you should be concerned when people are quiet. Probably something is boiling inside. We have a proverb in Africa that says that the rivers that are quiet, they flow under. And that is what cancer does in the initial stages. The disease grows without immediate pain. Without screening, it remains invisible. So if discovered early, then it's easier to deal with. You might not feel any pain, but sometimes, most times, cancer sends signals. You see, that is why screening is very important. But after so many months, depending on the type of cancer, we'll get to know, then it spreads and take over. So there is systemic inflammation. When this happens, then the cancer has taken over the body, and then what happens? That is when we really see the symptoms, which many people dread. The systemic inflammation, if you know inflammation, scientists put it that it has about 5 signs of inflammation. Once the body is in this inflamed state, you feel the pain, you feel some heat. At night, you can't even rest. There's so much heat. Then you might see some places swollen, and then the cancer really comes out with all its forces. Then there's loss of function. So this all takes a toll on the body. So people start losing weight, have no appetite, but even those who have good appetite start losing weight. Then there's fatigue. Then, imagine, adults get cancer, children have cancers too. So at this point, the treatment becomes very uncomfortable, even if it's just surgery. The pain, how to heal, takes so many days. Then the discomfort of the chemotherapy or the radiotherapy also come in because the body is already weak. Talk about the psychological impact it has. A mother seeing the child suffering, not eating, just sleeping, looks into the caregiver's face and then hope for something. And then also on the family taking care of this sick person. So all this come into play when the cancer is already in the advanced stage. The beginning, you might not find it. So that is why there's so many campaigns. I believe this is not the first time you are hearing about screening. It's vigilance. We know it can attack anyone, anytime, any age. So there is the importance of screening. Screening starts from when you go to the hospital for consultation. So the doctor asks you why you come, and you say, oh, I'm coming for my annual screening for checkup. So then you ask the history. If anybody in your family has this disease, that disease, somebody, if you want to screen for cancer, have somebody in your family had cancer screening, cancer before, what type of cancer, all this come into play. Then the doctor will say, okay, I would like you to do this type of blood test and that. Then we choose which procedures or test needs to be done. Usually for men over 50, it's recommended that you do the PSA, which is the prostate-specific antigen that can be easily detected in your blood because this is a biomarker, and we know the levels should be less than 4. So when it's rising, then you know that probably the prostate is under some stress, and then something has to be examined to know it. Women, we talk about mammogram after 40 years. And then even the younger ladies, physical breast examination will show you if there's something wrong with your breast or in the nipples. And then sometimes you are encouraged to do self-breast examination at home. But once a while, every 3 years, it's better to have a physician check and then examine you well. Then the cervix, it is recommended that sexually active women, because this is caused, it's been established that majority, over 90% of cervical cancer is caused by the papillomavirus, which is transmitted through sexual activities. So if you are over 18 years and sexually active, it is recommended that you do screening. There are so many screening depending on the facility. Low resource places have the VIA, visual inspection with acetic acid. Places do pap smear. Places also just do some scanning to see what is happening there. Then it's recommended that also we eat, we go to the washroom. This tract is very important and cancer can develop there. So you'll be asked to do occult, fecal occult blood test that detects whether there's bleeding from somewhere. If it's from the upper part of the body, usually the stool will become dark. And if it's the lower part, you see the blood. But how many of us go to the loo and then turn around to even look at the color of our stool? So this is what happens. So sometimes you can also use the sigmoidoscopy to check what is done. So like I said before, with the prostate examination, in low resource places, digital rectal examination is used, but now with advances in technology, a lot of scan can pick it up. So at places which are well resourced, then they do not need to do this manual examination. Then when it comes to a place, we need to do more diagnosis and really manage what is happening. Then I already talked about the blood test and other things. There are some images that are also used, like X-ray will be able to show you cancer in the lungs or in some in the bones. CT scan, which is the computer tomography scan, and then magnetic resonance imaging, ultrasound, and positron emission tomography are all advanced forms of monitoring, screening, and monitoring tools. Sometimes you will also see that the swelling electron and microscope, powerful thing to see if the cells are in their normal state or there have been some abnormal cells. This will also help to determine the form of treatment you have. Then for prognosis and further things, there's this precision molecular genetic testing to help us know how the cancer is progressing, what will it do for you now. It is always said, early detection saves lives and or improves survival. So it is very, very important for us to take this screening, especially when we are well, to screen for what is happening in our body, because that is when we can know how to deal with it. When something is found, then we have to mobilize all the arsenal to find a way to help the victim. When I talk about arsenal, surely I love football because of the health benefits, but I'm not here today to promote the popular English football club. Arsenal also means resources. So there are so many resources being worked on. Scientists are in the lab, checking, pharmacists are testing medication, surgeons are finding ways they can make things better. So when the cell is contained, then just surgery can be used to at least remove the abnormal cell growing to take over. And this is some parts of the tissues which have been affected. But sometimes we do not know how far it has leaked underground to other places. So chemotherapy has been one of the golden standards used to treat cancers when we suspect that they have been spread somewhere. What is chemotherapy? it is a cocktail of very strong medications, systemic drug, that destroy rapidly growing cells. Many people have heard about chemotherapy, chemo, and they fear it because these medications are strong as they are destroying the rapidly dividing cells. Some of the good ones also get affected, and because of that, the body gets weak. So chemotherapy is usually done in cycles, depending on how advanced the disease has gone. To give the body, you finish one cycle, you wait a little bit, then you go again so that the body can recover. And it comes with different side effects, especially people fear the side effect of losing the hair. There's also the radiotherapy, which is high energy radiation used to target some specific cancer cells. It damages the DNA. So the doctor will decide which one is good for you and then will be used. Some cancers respond better to radiotherapy, some respond better to chemotherapy. And sometimes some of this treatment has to be combined. Thank God, with advance in science, there's now also targeted therapy, which is a precision medicine to target the very cells which are destroying the body, the genes, the DNA. By so doing, they really spare the healthy cells. When the healthy cells are spared, then the side effects are less. But this is not in every facility. So whichever is available, the doctor thinks about it. Then there's also the immunotherapy. The immunologists among us know that, or if you ever did science in high school or in medical school or whatever you did your science, you understand that the body has some immune system that protects us. Some protect, some fight some infections that come into our body. So they are there already. But imagine these rebellious cells coming against this quiet army, small army working. Sometimes they can easily overcome them. So the immunotherapy is a way, they call them the biological modifiers, to strengthen the immune system, which is already there, so that they can fight the aggression in the body. So immunotherapy is another form of cancer treatment that is also available to help people fight cancer. Now you go to the hospital, you look at the doctor, they say, this is the situation. It's not that easy to decide, have surgery. It's not that easy to do this. They have, especially if they know how far the disease have gone, doctors become very, very helpless to know how to help. There's that feeling of helplessness. That is why they work in teams, so that there will be the support. Sometimes it's difficult, weighing the moral distress. They have moral distress, weighing between life and death decisions. Probably you are fine now, but when we give you the medication, you feel weak, and people through the weakness and confusion lose their life. Then you would have thought, if I had not even done this, given this medication, probably they would be fine. So sometimes you have to be advocate, trying to also help them cope with their problems. So compassion, they can feel compassion fatigue, struggling to maintain empathy and still be very professional. They might also have their own problems at home, or some might be even dealing with some disease, one disease or the other, but you are looking to them to help you, and they have to do that. So what is important? Sometimes the burden of communicating and delivering bad news, to see the patient and said, you look fine, but where the disease have reached, it will be very difficult. So how do you combine all these things to be able to navigate through it? Yet we know that cancer, the diagnosis of cancer is not a death sentence. Many people survive, especially in the early stage. Greater percentage survive this cancer threat. Even at what we call the late stage, yes, there's hope. Some people are able to survive it. If people in the initial stage, 90% will survive. Now it is known in some countries, there's over 80 people with breast cancer, 98% can survive. Yet, for some cancers at the late stage, probably 20% will survive, but at least some people have survived. So what we want to look at next is the survivor. What makes some survive and what makes others succumb? It's not it's not because somebody doesn't have. It takes into consideration the type of tumor. Some are very aggressive and some develop slowly. It takes into consideration the stage the cancer is found. It takes into consideration your ability, your diet, your lifestyle changes. For example, if you're a smoker and you've been diagnosed with cancer, would you stop the smoking? The doctor will tell you stop it immediately. And whether you will do it or whether you continue your enjoyment for it to take your life. But while biology and lifestyle matters, access to quality healthcare is a critical predictor of survival. So that looking at people in the rural areas where there's no hospitals available and they have cancer, thinking of I don't have money to travel to the city. And then people in the city, even who have the hospital and also will not be able to go, there's no one to send me there. It's also getting quality healthcare is very important. And that really brings the disparity between the global north and then the global south. Let's look at some of the statistics. So this is when geography becomes a destiny, survival gap. If you look at some global north countries like United States, the recovery survival rate is very high. You look at some global south like South Africa, it's quite low. Which means survival is not only influenced by the biology or your lifestyle, but the social determinants also play a critical role. What are the insurance policies in those countries? What is the education going on? What support do people get for their medical situations? This all come together to really shape how people are able to survive the cancer maniac. So let's look at the holistic part of it. All this comes that beyond the diagnosis is the quality of life. What is quality of life? Living happily and dying in dignity. We know everybody will die from one disease or the other, but cancer brings so much fear. Why? So WHO emphasized that holistic well-being through people-centered care. So we have to look at every stage. The survivorship. What can people survive? Your ability. What is life before I leave? So comes with your willpower to live, your willpower to do everything within you to survive, if it depends on you. If it doesn't depend on the doctors or the health system or anything, if it depends on me, I'm going to live. that is health. Physical rehabilitation is very important. Psychological support. Do you have people around you who will tell you, move on, we are with you, we are holding your hands, we are praying for you, wish you speedy recovery? These are all emotional support people need. Then one thing we don't have to forget, nothing is free in this world. So managing the economic impact is also part, whether you have people to support you financially or whether you have the enough saving to do all the tests you've been asked to do and to go through the treatment, can also help people survive or succumb. On the other hand, if we have to, we pray that death do us and the pain path. We don't let that happen quickly, or you have to help the person live in dignity. It's not just waiting for death, but pain management, spiritual support, family support is very important, so that even at the last stage of your life, you can live a quality life. In some countries, there are hospices where a lot of people at the last stage of their life are brought together and given all the support by the government, by professional healthcare providers, so that, and then all group in the same place, they support each other. But it does not happen in every culture. Come to Ghana and then saying that a relative had cancer, so I'm going to send them to the hospice. They will think you have abandoned them. Things are changing. We don't know when it will, but these are some possibilities that will help to have support groups. People who are facing the same challenges usually support each other easily. Let's cap the theme for the World Cancer Day, United by Unique. Yes, we face a disease that manifests differently in everyone. That is the uniqueness. Even that there are cultural different individual beliefs and everything. But when we stand together in research, in support and care, that is the united, we can fight cancer and then make everybody live happily. So some people have survived, and I would like to share the stories, their coping techniques for survival. Just giving 2 examples here. Amma used agency over fear. What does it mean? Amma was well. She found a lump in the breast, went to the hospital. Nothing wrong with her, she thought, except that the lump in the breast. But she was told to undergo chemotherapy. And she has heard that chemotherapy really let people lose their hair. So, okay, then why not shave my hair so that I don't even lose it? So Amma had the hair shaving and went through chemotherapy, all the cycles. When it was finished, happily, she saw her hair growing. Amma is now cancer-free. Her hair is beautiful, and she's happy. She didn't let the fear of losing the hair deter her from having the treatment that could save her life. Then it's Ajwa, who also shares the testimony that she's overheard the nurse saying, "Oh, cancer, that's serious." I mean, then she said, "Even if it's cancer, I know I'll be well." That is faith. So when she met the doctor said, "Do you know why you've been asked to see me?" She said, "Yes, they said I have cancer, but even if it's cancer, I believe I will be well." So the doctor said, "Your faith has made you whole. I'll be your doctor through the procedure." One thing Ajwa did, she kept all the doctor appointments. She underwent radiotherapy, still praying that she will be well. Not abandoning treatment to go to some place and then suffer it alone, or to just hope that just prayer. Yes, miracles happen, but when this is also a miracle that you go through the procedures so that you will be made whole. Ajua kept her appointment for 10 years until she was told that there's no more cancer cells in your body. You don't need to see the doctor again. What a joy. Ajua has lived many years and she's still alive, enjoying her survival. That is how we can fight and overcome things that are scaring at us. So in summary, I would like to say, everyone is at risk of cancer because there are so many cancers. You have things. There are several types of cancers, but the cancer progression, although it's complex, some are predictable. Some go so fast you cannot predict it, but many of them are predictable. And some kinds of cancers are preventable. Example, the one that comes as a result of our lifestyle, and the one's infection, you can be vaccinated. The government said all school girls before starting sexual activities should be vaccinated. In that case, you are prevented from cervical cancer, or at least the risk is significantly reduced. Remember, early detection saves lives or improves your survival. That is very important. And comprehensive care improves outcomes and quality of life. I also want to tell the caregivers among us that we must be mindful of our own vulnerability, taking so much burden. You need support from your colleagues, you need support from your family, and you need to take care of yourself too. Health caregivers also need to screen. I wonder how many people of us here do this yearly screening of our body to know that everything is fine. Way forward, let's remember, early detection saves life, prevention too. Cancer is a complex, rebellious group of diseases, but knowledge, prevention, early detection, and adequate management is the strongest weapon we have. So let's put all this together and then fight cancer to win. My take-home message or inspirational message to you is that when we are united in care, cancer loses its grip on life. When we are united in care, cancer loses its grip on life. Remember that. These are my references. Yes, a lot of study went into this, and I acknowledge people who have been working on cancer so that our life become very enjoyable. So many references, and that is what we build on it. Thank you very much. Please share your unique story for support and to support. Thank you.
Thank you very much, Dr. Nuamah. This is very important. It's not just about the science, but also the care. And like you said, when we are united in care, cancer loses its grip on life. That is something that will stick with me from this engagement. Thank you very much for the presentation, for taking us through the basics, and also the management and the options that there are. At this point, I would want to check if there are any questions. I'm looking in the Q&A. There's no questions so far. Okay, I think one has come in. Yes, so I have a few questions that are coming in. So I'll start by reading out the questions. And Dr. Nuamah will be happy if you can help us to respond to them. So I'll start with Gabriel from Nagoya University. And it says, what lifestyle and environmental factors are driving cancer cases in Ghana today? Should I ask a number, or you would want to take them one by one?
Okay, I can answer this.
Okay.
Oh, that's a very good question. I believe Gabriel is from Ghana. So, yes, I missed to mention because the environmental factors now grappling Ghanaians now is the illegal mining. And there is evidence that people using these heavy metals like mercury for mining are predisposing themselves to a lot of cancers, especially cancers of the blood. So these environmental factors have come to stay with us in Ghana, and we should be mindful of it. Yes, galamsey is causing the cancer prevalence to increase in Ghana.
Okay. I'm sure that is them to it in some way. All right. So I'll move to the next question. It says cancer diagnosis and treatment are costly. How is the government's intervention in the lives of those affected? Is the government in any way supporting any cancer management?
In Ghana,
Yes.
some like the childhood cancers are on health insurance, but when you go to many hospitals, already embedded in the health insurance. But we know that cancer treatment is very expensive, and a lot of the medication. The management is not only the medication. If we say management, like going to the hospital to be taken care by the doctor, is covered by the government. You don't pay for the doctors and the nurses' treatment but you have to go and buy the medication, which is from the pharmaceutical companies. They are making a lot of money. So those ones, most medications are not covered by insurance. But your management, that you are in the hospital bed and that is taken care of by the government.
Okay. So at least there is some support for the whole management pipeline. So that's good news. The next question says, can people get cancer regardless of age? Can people get cancer regardless of age?
Yeah. And remember, sometimes the mutation has taken place long ago before you were born, so in your genes, and when the condition comes. So yes, regardless of age, you can get cancer. The good news is that the younger people recover energy, recover faster than the older people. So childhood cancers are easily treatable than adult cancers. And if you are in your 40s or 20s, and you get cancer, the recovery, depending on what you do, is faster than somebody in their 80s and 90s getting cancer. But it affects everybody.
Okay. So I guess children have higher regenerative power in their cells, so are able to heal faster. I think it also goes with wound healing. When you are younger, your wounds heal faster than when you're older. Okay. The next question on the tab says it's from Abdul Rahman from Ghana. How does cancer spread from one person to another? Does cancer spread from one person to another?
Okay. Cancer is put in the form of non-communicable diseases. So cancer itself will not spread from one person to the other. But imagine the cancer is caused by viruses. Somebody has the papilloma virus in the body and has cancer, and the virus are still in the body. Then the virus can be, or the person has the cancer, which is not spreading, but the virus can go into another person and start the cancer again. That is where the issue lies.
Okay. Yes. So, Abdurrahman, I hope that answers your question. The next one from Isaac Enin says, please, what about the use of laser in treatment? The use of laser in treatment.
That is a dicey question, but I'll try to answer. You know, I mean, laser is part of radiation used, and we are talking about ultraviolet radiations and other things. But the good thing is that there are different parts of radiations. We have the protons, the neutrons, and so many things. And I believe the laser, it depends, they have tested, and usually before it's used, there's the clinical trials to know that this radiation we are using would not cause cancer. So before any, like we use X-rays, but yes, it's also used to treat cancers too, and diagnosis, and X-ray is also radiation. So I believe that because it's been tested and know that it will not cause the predisposition is very low.
Okay, so relating to that, I'll ask one question before I go back to the chat. So let's say you have in stage 1 or stage 2 cancer. Which of the treatment options would you say is the safest? If you are to treat a stage 1 or 2 cancer, which of them would be the safest, or the option depends on where the cancer is? And obviously, I know depending on the stage, some particular ones work better. But if you are considering cancers at the same stage, which of the options is better?
Good. So it depends on the cancer, obviously.
Okay.
So the oncologists are best actually answered this. But we know that when it's stage 1 and 2, I mean, most of them are localized. So surgery is used to remove the cancerous tissue as much as possible. And because sometimes we don't know how it's saved, then some chemotherapy or radiotherapy is added. That's why there's the neoadjuvant or the adjuvant chemotherapy. So because we don't know, we have staged it at 1 or 2. Surgery is usually what is used to treat it. Okay. And sometimes laser, the same laser is also used to help to remove some of the ones we don't see.
Okay, thank you very much. So I'll go back to the dashboard. So the next question is from Joseph Nuamah. And the question is, what is the most important thing to remember if or when you are diagnosed with a cancer?
When you are diagnosed with cancer, the most important thing to remember that it is not a death sentence. Put all your resources together. Go for medical management. You will have a team of people around you. The doctor will decide what to do, which test to take. Have your pockets ready to pay for it, and then you'll be fine.
Okay. The next one also the next question from Ruth Nuamah. Says, in the Ghanaian healthcare setting, how accessible is prostate cancer screening for men without symptoms? For example, can patients directly request PSA testing, or is screening generally initiated through clinician recommendation and referral pathways? So he's talking about PSA for prostate cancer, whether someone can request for it directly or it has to be based on the recommendation of a clinician.
Usually, you can come to the hospital and you say you would like to be screened for prostate cancer, and the doctor will write a prescription for you to go and do it, not based on anything, because it's recommended that this screening is done very often. So some laboratories will even take it without prescription, depends on which laboratory, but some other places will tell you that let a doctor prescribe it for you so that if there's anything found, it can be reported back to the doctor. But you can walk to any facility and request for that.
Okay. All right. The next question I'll skip because I think the question has more or less been answered. It says a cancer diagnosis often feels like a death sentence. What is your advice? I think it's covered by one of the answers you gave earlier. So I'll jump to the next one by Irene Boucher. And she asks, when cancer spreads to other organs, can the degree of spread be controlled?
Once it starts spreading, yes, that is when chemotherapy is used to really control the rapidly spreading cells. So that is the now the gold standard when it's really spreading. But like you said, many other treatments are evolving, so surely it can be controlled.
Okay, thank you very much. And then I have a last one here. It says, are there any ongoing research initiatives in Ghana specifically focused on developing new drugs or therapies for cancer treatment, like monoclonal antibodies? This is coming from Evans Lockton.
I'm not very sure, but I believe that a lot of research is ongoing in different fields. And if monoclonal, because there are some early people have been thinking of early predictions using machine learning. This study is ongoing. So with that, I believe a lot is going on, but I don't have the specific answer now. And I cannot pinpoint some places where they are doing this. I know there's a lot of interest in the social media that early prediction using machine learning is ongoing in some facilities.
Okay.
So if anyone,
I have a few more. Oh, sorry. I have a few more. I hope we are still within time. So the next question from Peter Inda says, please, would you classify palliative care to be covered by the NHIS scheme? Would you classify palliative care to be covered by the NHIS scheme?
Yes, we are saying that for people to be able to enjoy quality of life at end stage, when they were younger, when they were not sick, they worked. So I think we will all have loved that there are policies to take care of palliative patients, but it's easier said than done. So like I said, even in Ghana, we don't have hospices where palliative care can be holistically done. But I would recommend in the good times that palliative care is covered by insurance.
Okay.
Because every person is unique.
Okay. Thank you very much. So some people are putting their questions in the chat. I would encourage that we do that in the Q&A session. So I'll take the questions in the chat and I come back to the Q&A tab. So in the chat window, James says, is it true that using microwave to heat food causes cancer?
There's a lot of social media information that microwave causes cancer, but when you look at the research published, they say it's not true, it's not, how do you call it? It's not, what's the word? Confirmed. So I haven't done those. So if there's anyone on the panel or anywhere who can answer, but there's no evidence now in the scientific papers that microwave causes cancer. That is what is there in the literature now. But there are a lot of social media information out there.
Okay. I think sometimes the worry there is also not through the food, but the waves that are actually used to warm the food escaping from the containment. And if you are standing close by, I mean, that's how some other people interpret that. But anyway, we'll go with the fact that there's no concrete scientific proof. Yeah.
To add to it, I would say that sometimes the container also used, especially the microplastics that people put into the microwave, can also cause predisposed to cancers. So it might not only be the radiation. We use laser, we use X-ray, we use so many radiation. So what the food is put in can also be a cause of it. So a lot is not confirmed, and a lot of research is needed in that area.
Yeah. Okay, thank you very much. And then again in the chat window, there is a question relating to, let me just read. Malik says, is fasting and sugar-free diet another alternative to reduce the spread of cancer?
There have been some information that fasting, medical fasting, usually because the survival of the fittest. And we know that although cancer cells are very aggressive, they are weak cells. And it is said that when there's medical fasting, the weaker cells are destroyed first. So there's some information that fasting help to really reduce the spread, the aggression of cancer. And we know everybody likes sweets. So cancer cells might also like the sweets, especially we said that they also like, hemoglobin and other things. So if there's so much sugar in your body and then it helps the cells get energy to grow faster, then reducing it also reduce the progress. That is the mechanism that we can help. So fasting may help, that may help.
Okay, that's good to know. So I come back to the Q&A tab, and the next question there is, what are some lifestyle modifications we can all employ today to reduce our risk of cancer? This is coming from Ninoy.
Good. So we said that is very important. When cancer is as a result of acquired genetic mutation, what happens, like there used to be a lot of smokers even in Ghana, but there was so much publicity against smoking, even in public places. And that has actually reduced. You hardly see people smoking around. And it was established that smoking really causes most of the cancers, because even now when you look at the pack of cigarettes, it's written on it, it causes lung cancer. So smoking, at least stopping smoking reduces your chance. We've talked about infections. So protecting yourself from the viral infectious agents like hepatitis B and C, and also for the papilloma virus, it can reduce your chance. So at least 4 cancers already covered when you have been able to protect yourself. And then going out using screening skin screening, another thing will also reduce the chance of getting skin cancer, different things. And then the women, I forgot to even mention this in the lecture. In Ghana, bleaching is also associated with some type of cancer, not only skin cancer, so that lifestyle changes will have it that, please, let's stop the bleaching. And then douching. Some people insert some chemicals in their vaginas to tighten it. And this really causes inflammation in the cervix area, so that it's easy to get infection. So please, there are steps we can do to really reduce our chances of getting some of the cancers, especially if it's not genetic.
Okay.
May I come in with a quick question, yes. Dr. Nuamah?
Please.
Thank you for the exciting, insightful presentation. I have concerns about galamsey and the things that we are exposing ourselves to because of the pollution of the water bodies. Do you have any thoughts on that in terms of cancer and what that might bring to us down the road?
As already mentioned, yes, the heavy metals, especially mercury, being used. We know that Japan even accidentally had this Miyamata disease because of leaking of heavy metals into the nearby ponds. So that this is a big issue, and I think a lot of lectures against it has gone on already in Ghana, and there have been seminars to talk about stopping galamsey because of health issues. The mercury seep also into the rivers, and then we eat the fish. We all love tilapia, and we don't know when they are bred from these galamsey areas. Then it goes into our systems, can cause cancer. So there's a big concern. And as we are speaking about this, I believe that somebody picks it up. We all try to protect ourselves. We all try to join the discussion so that at least illegal mining or the use of heavy metals for mining is really taken care of in Ghana so that our health, yes, it is a big issue now, national issue.
Big one. Yeah. George?
Yeah, that's it. That's the only
Okay.
question. Thank you.
All right. So I'll quickly come back to the Q&A. And the next question is from Abubakar Rahman. And he says, if the tumor or lump or affected tissue is so tiny or affected a localized part, can you skip the surgery and go straight to chemo or radiotherapy? I think this is a person who is afraid of the knife.
Yes, sometimes some of the cancer, you will see that they have formed a tumor, so it could be just spreading. Some skin cancers, you wouldn't even see a big tumor sample has spread already. So yes, like I said, this is the burden of the oncologist, and they examine you to know which model is good for you, which treatment modality is best. So it will come all through the history, through examination, through the blood test, and then to know whether you don't need to go under the knife if you are scared, but you need either radiotherapy alone or you need chemotherapy alone. Especially a lot of women with cervical cancer do radiotherapy and then they survive very well without any surgery. And especially if the cancer has gone very far, even the surgery will not help.
Yeah. So I'm just thinking, I think this question came out of the point you made about if it is localized, then surgery is the best because then you can just excise whatever it is because it has not started spreading. And so his question was, so if it is localized, can you see if surgery is still the best, can you still opt for another option and would it be effective?
Yes, now this patient-centered care. You communicate with the patient. The doctor doesn't put their will on you. So the doctor will sit with you, communicate, show you the options, and ask you, what do you think? Sometimes patients tell doctors, you decide for me. Then they will look for what they think is best, but it might not be what you would have. But if you think, if the doctor says A, B is best for you, and you think C, D is best for me, then the doctor find your way and do it the way you want, still supporting you. So yes, you can discuss that I don't want to go through this, but I want other alternative. And ethically, the doctor has to listen to you and you make the decision together.
Okay. Thank you very much. Next question from Benjamin Ansaiji. So his question is, cancer is a genetic disease and genetic variations contribute to tumor subtypes, disease grading, and tumor prognosis. What are health authorities doing in supporting cancer research to support personalized and precision medicine in cancers? Basically, I think the question relates to, is there any support from health authorities for or to promote research and into personalized medicine for cancers?
Like I said, a lot of research is going on throughout the world and also in Ghana, and there's some collaborative research. The government come in when we have proposals and we bring it before them that I think we should do this research that will be good for the community. And they read it, they wouldn't, politicians are not scientists. That's why we have the scientists. If you have a good proposal that will save life, that if the precision therapies and other things help, I believe the health authorities will pick it up and then submit it to the government for some of these policies. Research is supposed to help stakeholders make policies. So they don't know what to do except you bring a proposal to them. So let's write the proposals. Let's get interest in research. And even as we've heard today, if you think there's some areas that needs to be researched, which has not been done, and you need the government support, I believe there's a lot of money for research in Ghana, we were told, So depending on the proposals you write and then knowing the right places to submit it, we can go into that. We start somewhere and we are progressing. Thank you.
Okay. Thank you. So the next question I think has been answered relating to low sugar diet and whether that can help cancer. And then the next one also about lifestyle modifications we need, that has also been answered. So the next and the last one I have here says, please, I would be glad if Dr. Mercy can throw more light on the contribution of untreated infections to the prevalence of cancer, because it seems to me that the focus has always been on other causes. Is it not possible that we are ignoring something very significant? If I can quickly summarize, is looking at what is the effect of untreated infections on cancers, untreated infections. I think because you mentioned the fact that some viruses, you mentioned papilloma virus, can cause cancers. So are there other infections, if left untreated, can also result in cancers?
Okay, we know that, like you said, we have the genetic and the lifestyles acquired mutation. It depends on what kind of infection. Now, like the papilloma virus infection, they have rolled this vaccination that everybody should be vaccinated, especially before starting sexual activities. So if you are vaccinated, then of course it reduces the prevalence of the cervical cancer. And then hepatitis B and C too, there are vaccinations for them. So if you check and you are free of it, you can be vaccinated and you don't get it, so that those who have it cannot infect you. And if you have show up that this and medication is given to you so that you don't spread it to others. I think there are health policies to treat this virus, these infectious agents, but people do not want even to own up. Somebody has Hep B, they keep it to themselves, they won't go to the hospital, and then the infection keeps spreading. But if you go to the hospital, you will be treated and you will not be infectious to other people. That is, But other than that, the cancer itself will not really cause infection. And I want to also mention, sometimes cancer spread easily because of comorbidities. Somebody who is not sick, but just the cancer can recover easily. But if somebody has some other HIV infection, and then gets cancer, then the treatment becomes more difficult, So any type of infection can really give you a bad prognosis for the cancer. So if you have any infection, please go for medical treatment, and that will also really reduce your chances, or what do you call it, of getting the other diseases. Or when you get it, you can survive better.
Okay. Thank you very much. 2 more questions have come in. Let me just announce, I'm hoping by 3:35 we can end this. So let me quickly ask the 2 questions. So the first one is, I want to take you into cancer biology. It says, any remarks on GLP-1 agonist and cancer? Can using chemicals to get slim give you cancer? Can using chemicals to get slim get, so the second part of the question is, can using chemicals to get slim? Yeah. Oh, it says, can using chemicals to get slim give you cancer? If you take chemicals to slim down, and then specific to that, he's asking about GLP-1 agonist and cancer. But maybe let's focus on the earlier part, whether taking chemicals to slim down can cause or can give you cancer.
Chemicals, you know, they are not biological part of your body, so they weaken your immune system, number one. And we know that if your immune system is weak, then anything that happens is very weak. We are combined with so many things that can get it because the body is strong to fight. There's the genetic mutation in your body already. But if you use chemicals to slim down, you are weakening your body's ability to fight anything that comes in. So yes, it might not cause the cancer, but it predisposes you to getting it when you are attacked by it. I think that's what I know.
Okay, so I'll follow that with a question from the same person, Betty Bandopong. She says, cancer whilst pregnant, how do you manage that?
So, like I said, yes, pregnant people get cancers, and all you have to go is you'll be referred to the oncologist, and depending on the stage and the stage of the pregnancy, you'll be advised what to do. You know, sometimes you'll be told to wait until the baby is born, then you go through the chemotherapy. Or if the cancer has advanced and is going to kill you and kill the baby, then they will start the treatment whilst you are still pregnant. So at least to save one person. It's all to go for consultation.
Okay, so consultation with the clinician, important. The next one from Patrick Affle says, if Dr. Nuamah is given the chance to influence policy, what can she do or say differently to help our unity against cancer? What's unique thing? What can you do or say differently to help our unity against cancer? I am sure our fight against cancer, yes.
Okay, so we said united by unique. So we should not actually victimize cancer people. People have cancer and they don't even want to talk about it because, oh, she has cancer, as if it's infectious. So if I can change policy, I would say people should be supported, should be willing to talk about cancer. I have had cancer, what can I do? And people should not victimize us. Our mindset against people who have cancer, because it can happen to anybody, any age, rich and poor. So those who try to victimize people who have cancers are the one causing the prevalence to go high. Let's unite, let's support, because it can happen to anybody.
Okay. Dr. Nuamah, the very last question. Okay, the very last question that will bring it to an end. So someone says, we often see some countries claiming to have a cure for cancer like Japan and China. How true is this? Is there a cure for cancer?
Recently, yes, but the past, how do you call it? There was social media trending going on recently that some countries said they found cure for cancer, but they couldn't publish it. But as soon as United States left the NATO, a lot of breakthroughs are being circulated on the internet. I hope, yes, we have cure for cancer. We are searching. Yes, a lot of people survive, whether it's because of cure, whether it's because of medication, whether it's because of, their management. Yes, we are all hoping that cancer will be something of the past. So we'll be happy if these studies go on. I've seen a lot of things trending. Turkey, Japan, Russia has vaccination against some cancers. Yes, but all this need to be verified. All this came out recently, and research has to be proved that these are true or not true.
Okay. Thank you very much, Dr. Nuamah, for this very insightful session. And at this point, I would like to bring this session to a close. So thank you once again for the time you spent with us, educating us, giving us all this information, and also what to do to avoid or to prevent cancers if there's anything like that. So we are very grateful to you, and I'm sure CoBReG, the board would reach out to you later to also say a very special thank you. And I would also want to say thank you very much to the audience for all the questions. On average, we've had about 25 questions, and Dr. Nuamah has responded to all of them for us. We are very grateful to the audience for this as well. To the audience, let me also say this is the CoBReG Platform Convention for Biomedical Research Ghana. If you are not a member of CoBReG, this is what you are missing. We invite you to sign up to be a member of CoBReG. If you go to www.cobreg.com, you would see information on how to become a regular member of the association, because this is done regularly to educate us, but also for networking purposes and to create platforms for exchange. So thank you all very much. Thank you to Nana for the invitation.